Hello, everyone. My name is Yaobi Zhang from Helen Keller International. As the current chair of the NTD NGO network, it is my enormous pleasure to welcome everyone to the 11th NNN annual conference. Before I continue, I would like to invite Janine to quickly go through some housekeeping notes. Janine.
Thank you, Yaobi. Good morning, good afternoon, and good evening, everyone. I know people are joining as I say this, so we will post these notes somewhere for everybody. Before we begin the housekeeping notes, we are delighted to offer French and Spanish interpretation for the opening and closing plenary sessions. You will see on the Zoom bar the interpretation button. Please click this now if you would like to switch to the French or Spanish channel.
Bonjour, pour écouter la version française, il faut cliquer sur Interprétation dans les options de la réunion de Zoom et sélectionner le canal français. Hola, buenos días. Para escuchar la versión española, se puede hacer clic en Interpretación en las opciones de la reunión de Zoom y seleccionar el canal español. Gracias.
I will just wait for a couple of seconds for delegates to switch channels if they wish to. And I'd like to say thank you very much to our French interpreter and our kind Spanish-speaking volunteers from the NNN community for supporting us with this. Please do take time to familiarise yourself with the agenda on the virtual platform and select the sessions you would like to attend over the next 3 days if you haven't already done so. We would like to encourage everyone to interact throughout the conference using the discussion, chat and direct message features on the platform. You will see the discussions tab next to the agenda tab at the top of the page with the drop-down feature where you will find the public forum and the social wall. You can also connect with fellow participants directly via the People tab. Simply select the attendee to view their profile and send a message. Their replies will appear in your direct messaging inbox, which you will find via the Discussions tab drop-down. During each of the workshops, we ask all questions and add comments via the chat facility on the virtual meeting platform. You will find this by going to the Agenda tab and clicking on the session, which you should have already accessed today to reach the plenary. To view both Zoom and the virtual platform at the same time, if you are viewing the sessions on one screen only, you can drag or snap Zoom to one side of your screen and select your web browser with the platform on the other side. You can then comment in the session chat box. We did send a video link out in your welcome email yesterday, so please take a look at this if you need to. Finally, remember that we, the NYT team, are here to help you with any technical difficulties this week. If you lose connectivity at any time, simply join back in when you can. All sessions are being recorded. Email us at admin@nnnevents.com with any other concerns and we will get straight back to you. Please, everybody, have a great meeting, and I'll just pass back to Yelby.
Thank you, Janine. And welcome again, everyone. This year's conference takes place virtually for the first time due to the COVID-19 pandemic. So while our agenda is shorter than usual, we are delighted that this virtual platform has enabled greater access to more of our members across time zones and colleagues from other sectors. I'm happy to share that we have over 1,000 participants registered from over 80 countries, representing more than 300 organizations, including NGOs, donor agencies, health ministries, academia, research, and individuals, particularly people affected by NTDs. So over the next 3 days, we have an exciting interactive agenda. So whether it is the COVID-19 pandemic, other public health emergencies, or the risks from the climate change, insecurity, and economic crisis, we know that this year's conference theme, Building Resilient NTD Program in a Changing World, is critical. It sets the tone for our engagement in the fight against NTDs up to 2030. So this agenda is a wonderful reflection of the work that comes together throughout the year through the NNN's cross-cutting and the disease-specific groups and other collaborations. So these groups are the backbone and the real work of the NNN. So you will hear more in my annual report. As WHO prepares to launch its new global NTD roadmap, this conference looks to expand the NGO community's understanding and build capacity to deliver the paradigm shift laid out by the new roadmap. So we will discuss ways to support the drive towards improved impact, cross-sector and cross-cutting partnership as set out in our best framework, and enhanced country ownership and resource mobilization. As a community of practice, we will strive to support the delivery of a broader agenda than that of just ending NTDs as universal health coverage, and a better world for all through achieving the 2030 Sustainable Development Goals. The NNN is a global forum for the NTD NGOs and offers through discussion, learning, and knowledge exchange a unified NGO voice on challenges and solutions to reach global NTD goals. We welcome you, regardless of your sector of work, area of expertise, or country, to join us this week and beyond to build healthy, resilient communities free of NTDs. I would like to thank the MYT staff and NNN Executive Committee, the Conference Committee, and the Influencing and Communications Task Team for working together to deliver this year's conference. A massive thank you to our sponsors for their generous support to enable this year's conference. You will see details later in my annual report and on the website. Thank you so much to the interpreters for the plenaries, and thank you very much. I now introduce Patricia Amira, a broadcaster, communications expert, and as of late, a champion for the fight against NTDs. You may recognize Patricia from WHO NTD webinar series, and today she moderates the next session, the high-level panel discussion. Patricia, over to you.
Thank you so much, Yaobi, for the introduction. Good morning, good afternoon, and good evening. I am delighted to moderate today's exciting panel of 6 speakers who together form a formidable cross-section of sectors and stakeholders invested in neglected tropical diseases. This year's NNN conference theme, as Yaobi has just mentioned, accelerating to 2030, building resilient NTD programs in a changing world. It's all about opening the NTD NGO community to be challenged to do better and to walk the talk of resilience and sustainability. And we hope this high-level panel will inspire and help you to do this over the next 3 days and of course beyond. So without further ado, I'd like to introduce our first speaker and of course question Dr. Mwelechele Ntuli-Manechela, Director of the WHO NTD Department. I think it would be good to start off by getting an understanding of the most important building blocks for resilient, sustainable health systems, and also to know how the new roadmap will help to establish these.
Thank you, Patricia, and thank you very much to the NNN for inviting me here today and for your enduring support. When I spoke last year, the roadmap was in development, and I want to thank you all for your contributions in making the draft roadmap what it is today. And today I ask for further support, and that's the support in bringing the roadmap and all it stands for to life. Like many other programs, NTDs are facing critical challenges in the current pandemic, both programmatically as we try to safely deliver programs, but also in terms of the wider agenda. In a world where we will have to achieve more for less, we must work together towards the common goals of SDGs and, more importantly, universal health coverage. The roadmap gives the NTD community a blueprint in which to do so and an opportunity to demonstrate how NTDs can support other sectors to leave no one behind. COVID-19 has shown us that the new roadmap is more relevant than ever. At its heart, it seeks to promote much needed resilience, health system strengthening, equity, and country ownership. However, success is not inevitable and fundamental shifts are required. True resilience and sustainable health systems will require a foundation of strong local and national leadership. Through a shift to country ownership, which is the key of the roadmap and the key to all we do, and nothing will be sustainable and enduring if countries are not driving it. Without strong leadership, there cannot be well-trained, committed, and appropriate health workforce to address the country's unique needs. Another building block must be to ensure that there is accountability, and that is about setting clear targets, but also being adaptive. We also need to measure the quality and impact of our work on patients who are already suffering from these debilitating diseases. It is crucial that in the midst of the numbers, this human suffering and our efforts to alleviate it are not forgotten. Of course, integration is vital. COVID-19 has shown us that vertical programming is a luxury we can no longer afford. Failure to collaborate and integrate risks all the gains of the past decades in all fields and not only NTDs. All of these shifts rely on core principles of equitable partnership, collaboration, and global support. We all have our roles to play for the roadmap to succeed, but we need each other. So I ask all of you, in the way that you have so passionately given your support to the development of the roadmap and its vision, to now continue and expand the support as we transition into implementing it. Let us today support the countries to build back better, working to cement the foundations for the resilient and strong health systems which will enable a world free of NTDs for all. Thank you.
Well, that's a call to action there, if ever I heard one. Thank you so much, Dr. Mwele. Certainly one that will be present in our thoughts throughout this session and during the conference. So our next speaker and question is to Margarita Focas-Licht, Chief Effective Partnerships, Global Partnership for Education. Now, it's all about coordinated strategies, you've heard there. How do we work together to reach all communities?
Thank you very much. And thank you to the NNN for inviting the Global Partnership for Education, also known as GPE, to join this conversation. GPE is the largest global fund solely dedicated to transforming education in lower income countries. And GPE is also a unique multi-stakeholder partnership. So why am I joining this panel today? I'm here because schools are powerful vehicles for health interventions. In the remote villages and towns of many developing countries, the local school serves as much more than a place of learning. It is often the site for vaccination programs, community screenings, or where public health campaigns are seen. There is a virtuous cycle between health and education. Healthy children learn better, and educated children stay healthier through life. Education suffers when children are not healthy. An estimated 500 million days of school per year are lost to sickness. We also know that better educated mothers have healthier and better educated children who are more likely to benefit from adequate nutrition and immunizations, attend school more regularly and longer, and study more frequently. Schools play an important role in delivering coordinated and integrated NTD and WASH interventions, ultimately increasing children's potential and well-being. The COVID pandemic puts the need to work across sectors in focus. In response to the pandemic, GPE has provided $500 million in grant funding to protect learning for the most marginalized children in 67 of the world's poorest countries. Out of nearly 433 million allocated so far, almost 40 million supports hygiene activities. Another 18 million supports school nutrition, and 8.5 million supports psychosocial support for students and teachers. In fact, the COVID pandemic illustrates more clearly than ever the need for collaboration across sectors. 1 in 4 schools globally do not have hygiene services, meaning that 462 million learners and their teachers have either no hand washing facility or no water at school, putting their health at risk. GPE is developing a new strategic plan to guide our work over the coming 5 years. One of the shifts we anticipate is connecting more strategically with other sectors to support children to be educated, healthy, and safe. We look forward to opportunities to work closely with health partners to help achieve our vision, which is a quality education for every child. Thank you very much.
You're so right. Thank you, Margarita. Your comments highlight the unique opportunities on the horizon for cross-sectoral partnerships to meet our goals for NTDs, universal health coverage, and indeed the SDGs. Now, our next speaker is Kelly Saldana, who's the Director, Office of Health Systems at USAID, Bureau of Global Health. As we, the NTD community, support endemic countries to achieve their NTD goals, what key learnings would you share from your work in health system strengthening to help accelerate ours?
Well, thank you, Patricia, for that question, and really thanks to the Neglected Tropical Diseases NGO Network for inviting me to provide USAID's perspective for the opening of this conference, and congratulations on having reached your 10-year anniversary last year. We recognize that the network plays an important role in advocating for holistic approaches for solving disease threats, approaches that prioritize locally driven solutions and engagement with all sectors, including communities, to promote equity and inclusion. And that's great, because that has a lot of parallels to the work that we do in health systems. So we recognize that some substantial progress has been made in some of the disease-specific programs, but really that there's a need across national NTD programs to integrate them into primary healthcare service delivery. And one of the key lessons I want to share from our work on health systems is that health systems work is messy. Neat, siloed, linear approaches don't work too well. For a long time, the health systems community focused on individual building blocks, and the results of those programs are mixed at best. I think ultimately, system strengthening requires a shift from siloed disease approaches or siloed building block approaches to approaches that address multiple functions of the health system simultaneously. So I recognize this is a big topic, especially in the NTD community, but to help accelerate the achievement of NTD goals, there's several considerations that you can incorporate into overall programs. One, as you're already doing, is engaging the appropriate local actors across sectors and levels of the system. But really, one of the things that we like to encourage people to do in health systems is to start with and understand the end state objectives and to work backwards from there to really think through all the different functions and aspects of the system that need to be marshaled together to achieve those end objectives. So, for example, how will NTD programs look when they've been incorporated into primary healthcare platforms? Will they be delivered through health facilities, or will they be delivered through schools and community groups? Will the drugs be delivered on an as routine or as needed basis as people come in for checkups, or will they be delivered on a periodic set schedule similar to current mass administration approaches? And what does the answer to those questions imply about the needed supplies and human resources for those programs, how often they're needed, where they come from, and what the process is for getting them where they need? So ultimately, at USAID, we think that resilience is built by linking community structures to health systems and coordinating the use of decentralized resources through local organizations. The critical aspect is identifying concrete actions that strengthen institutions for everyday services, such as health, so that collaboration and coordination becomes a natural extension of the work. And I think by doing that, NTDs will go a long way towards integration with primary healthcare and the overall sustainability framework that you're working towards. Thank you.
Wow, wow, yeah. Very open and insightful reflections from Kelly on the messiness, but necessary investment into health system strengthening. Thank you very much. Now, building off Kelly's comments, I now have the pleasure of introducing Dr. Govinji Gitahi, Group Chief Executive Officer, AMREF Health Africa. From experiences of tackling outbreaks and epidemics like Ebola, what lessons are key that will help NGOs to build more resilient health systems?
Thank you, Patricia. I'm a fellow countrywoman and glad to see you on the stage. I know you for some time. I'll reflect on three or four key lessons in my 3 minutes. The first thing is that COVID has taught us, Ebola taught us, and many other epidemics, including the local ones that happen all the time, measles, cholera, have taught us that a crisis response to an epidemic is only as good as the underlying health system. And I think many of the previous speakers have actually reflected on that, that universal health coverage as a system of providing an equitable, resilient, and integrated health system is an unavoidable discussion in an epidemic. And we have learned that across the continent, wherever there are pandemics or epidemics. And the best place where integration happens is the household, where mothers who take care of children do not deal with their children as having an NTD, of having an infectious disease, or needing water and nutrition. They deal with them as a household need. So that is the basic unit of integration that we must build up on moving upwards. The next lesson is communities, that communities in themselves are foundational and are resilient, even where there are tragedies, even when there are things that happen like flooding, climate change, epidemics. The communities stay together and always try to help each other. Our role is to build our resilience from a community base upwards. And for us as Amref Health Africa, we take community health workers and frontline health workers as the integration of that resilient health system into the community, so that community health is not based on facility access, but is based on integration of that need within the community. The third point is that because epidemics exacerbate existing vulnerabilities, in every time you are responding to an epidemic, whether it's Ebola or COVID, you must wear a lens of equity. Because even for NTDs, Patricia, we know that women and children bear a larger burden than the rest of the population. We know that the poor bear a larger burden for NTDs. So if you do not wear a gender and equity lens when you are responding to a pandemic, then you leave very, very many people behind. Finally, institutionalization. Institutionalization of equity, institutionalization of community participation, governance and country ownership, institutionalization of financing that ensures people can access healthcare without financial difficulty. And finally, that you cannot have good care for NTDs if you do not have UHC. So a call to all of us who may be dealing with general and vertical areas to all integrate universal health coverage in our call to better health. Thank you.
Excellent, salient points there, Dr. Galinji. Thank you so much for that. Lessons from Ebola will be critical to learn from if we are to navigate future outbreaks, epidemic, and indeed pandemics. Thank you so much. Now, I'd now like to introduce Paula Brandão, Assistant Professor, Department of Nursing and Public Health, Rio de Janeiro State University. Paula, what are the two big things you wish service delivery organizations knew when working with persons affected by NTDs?
Thank you for the question, Patricia, and thank you to the NNN for inviting me to contribute, representing the voice of women and men affected by neglected disease in the world. My name is Paula Brandão, woman, daughter, sister, friend, nurse, activist, nursing professor, doctoral student in public health. I love chocolate, watching the sunset, being with friends, dating, going to the movies, dancing, volunteering, taking care of people, and I am also a woman affected by Hansen's disease. In response to the question, my first thought is, because we want to be recognized for who we are, the disease must not define us. We are human beings who are born, grow old, and live in a historical and socially constructed environment, influenced and impacted by family, school, work, religions, and community groups in which we live in. Each of us is a unique being, and our uniqueness is what defines us. The first thing I suggest to organizations is to build interventions centered on people and community, not disease. In recent years, much has been said about the effect of stigma on the lives of affected people. However, little is said about the power relations that perpetuate stigma and cause discrimination. Even less on how to transform the structural issues that lead to these situations. Most people affected by NTDs belong to a layer of society whose voices are not heard, or when they are heard, it is a matter of conventionally. There is clearly a structural disadvantage fueled by poverty, lack of access to education, health services, paid work, and the consumptions of goods and services, which drive the standard economy and gender issues. Unfortunately, it is not diseases that are neglected, but people. Our life and our image in the face of the suffering we are affected by at a certain point in our lives should not be a commodity for exchange for financial reserves to implement a program or project. Organizations should seek to transform their communication policy and fundraise practices, forcing donors and international organizations to review practices and impose program practices which are removed from reality. NTD programs must recognize the critical role of affected people in the creation of solutions based on a situational analysis, working with the people who live the problem. The design of projects should be founded on the principles of participation, empowerment, and emancipation for life. Service provider organizations must also reflect on their mission to understand how best they can transform the lives of affected people. This includes their contribution to the state's accountability in guaranteeing the fundamental human rights of people affected by NTDs. Service providers alone cannot fight to guarantee rights with government. They must collaborate with the organization of the people affected in groups or entities that gather the representative voice to transform politics into actions from local to global. Organizations should encourage the participation of those affected in different areas of action and decision, not only as consultants, but with decision-making power just like other team members. Participation is an essential aspect of life. It allows social interactions and changes in structural relationships. It is a means for empowerment and the liberation of people. Thank you.
Thank you so much for that, Paula. I'd now like to introduce Alice Cruz, UN Special Rapporteur on the elimination of discrimination against persons affected by leprosy and their family members. What is the biggest challenge facing the global development community in achieving the new roadmap and the SDGs?
Thank you for your question. Paula Brandão has called upon us not to look at neglected diseases, but to neglected groups of people. People affected by leprosy and other NTDs experience the same conditions of deprivation, structural disadvantage, stigmatization, poor access to state services and diminished participation, which I refer to as subordination in trying to avoid the risks of concepts such as vulnerability and resilience that invisibilize power relations. I prefer to speak of subordination and systemic change. Subordination hinders achieving the NTDs and SDGs framework. At the macro level, subordination is expressed in the disproportionate impact on NTDs of the growing tendency to turn health into a commodity. At the intermediary level of the state, subordination is expressed in the lack of priority given to NTDs that, together with the limited resources of middle and low-income countries, leads to gaps in health systems and coverage that severely impact groups of people that already strive with barriers to access, such as lack of income to take public transportation or dependency of women on third-party authorization, usually on men's authorization, to get medical care. At the micro level, subordination is expressed in the limited structural competence of the healthcare workforce, meaning capacity in cultural, linguistic, gender, and socioeconomic characteristics of users, among other issues related to discrimination and limited participation of users in health services. Looking at your question from the viewpoint of subordination means taking into consideration power relations and moving, as Paula Brandão says, from a disease-centered model to a people-centered model as well as to the actual enforcement of human rights for all. From a human rights perspective, all rights are interrelated. The right to health is inseparable from the right to an adequate standard of living, which is closely connected to substantive equality. Substantive equality means that equality under the law may not be sufficient to ensure that marginalized groups can enjoy the same rights as everybody else. COVID-19 illustrates not only how subordinated groups experience a disproportionate impact of the current crisis, although they may be equal to others under domestic law, but also how a human rights approach to emergency relief must recognize existing capacity within affected populations, ensure their participation in humanitarian aid, and promote their development and autonomy. It must not just provide relief to passive beneficiaries. So how do we proceed towards substantive equality and systemic change? The answer to such question is of course too complex for our limited time, but what I have said regarding the COVID-19 crisis gives us some clues. Systemic change can only be achieved through enabling affected groups to have a voice and choice. Their autonomy, active citizenship, and democratic engagement in public affairs are key for any sustainable action. Without this, law in books and by analogy written public health strategies and signed NTDs will in great measure not be converted into law in action, that is to say, into reality in people's lives. Effective and not just tokenistic participation of the target groups needs to be enabled. Moreover, we must all understand that participation needs not to be based solely on cooperation and may need to be confrontational, and that it is up to the affected populations to choose their own strategy. But fundamentally, participation means ensuring that governments, NGOs, and intergovernmental agencies are accountable. I am afraid that until affected persons do not have a voice and choice, achieving the NTDs and SDGs framework will keep slipping through our fingers. I thank you.
Wow, very strong words there from Alice, you know, effective, not tokenistic, bringing back voice, and of course, bringing back the focus to people and the human rights within that. Thank you again very much, Alice, for that. Before we close this session, I would like to invite Dr. Mwele, as WHO NTD Director, to share closing reflections from some of the very strong reflections from the contributions of our speakers today. Dr. Mwele, are you still there with us?
Yes, I am, Patricia. Thank you very much. And sorry about the problems there with the sound. I'd just like to go through some of the comments, and I want to thank all my colleagues who presented on the panel today, and just give a few reflections, quick reflections coming out of the discussion. So first, what was brought up, and I'm going to go through, just as we went through the speakers. The first one is working in sectors. So I think Marguerite really focused on the importance of working across sectors and the importance of looking at this going back to what Givinji said about the household and the mother not having to deal with the health issues, with the NTD issues, but also with the education issues. So working across sectors for us is extremely important, and it's something that we are advocating for very strongly in our new roadmap. The second issue was the integration into primary healthcare. And I think this was a discussion brought up by Kelly Saldana from USAID. I think it's really critical that we look to integration, and if we are talking about leaving no one behind, integration into PHC is critical, and it's something that we must endeavor to do, and it's something that also through the roadmap we are focusing on. Givinji brought out several points, but I think that the fundamental point was his call for action, that without UHC, we are going nowhere. But I think the other thing was building on communities, which are resilient communities. We've seen how communities come out after natural disasters, after so many other things. Communities are always still left standing and they help each other through. So building upon that, I think that was, for me, that was one of the really critical messages that we need as the NTD community need to work on. And we are already working on that, but really making that our foundational system. So when we're talking about foundational systems for NTDs, we should be actually thinking about how do we build from communities rather than anywhere else. And our programs are very strongly community-based, but I think that, as well as integration, is critically important. And then finally, from the beautiful words of Paula, was the importance of a patient looking at the human being and not the diseases. And really, that is something that we also, in the WHO roadmap, strive to do, working particularly with the NNN community dealing with morbidity, focusing on how we can make this roadmap focus on a patient, on a human-centered approach rather than a disease-based approach. So based on just a little reflection of what I heard, I think there's really great linkages to what we are talking about in the NTD roadmap. And I really am very pleased to hear this, this kind of alignment. So thank you very much, Patricia.
So right, Dr. Monet. Human-centered, community-centered approach is absolutely everything. So thank you for that. I'd like to thank all of our high-level speakers as well for their contributions that was expertly shared given the shortened time frame of the high-level panel session. Thank you to our guest speakers and thank you to you, the NNN, for engaging. I now hand back to Yaobi.
Thank you so much, Patricia. And also a big thank you to all the panelists for your time and for your wisdom and for the inspiring words. So NNN is steadfast in its commitment to working with WHO to support affected communities and health ministries. So the new roadmap provides us with ambitious vision for innovative partnership and cross-sectoral collaborations. So our speakers have highlighted the challenges ahead, not only in making the shifts needed to create sustainable and resilient health systems, but also in managing resources, both human and financial, and in driving the inclusivity with affected communities, which is really at the core of our work. So we have our call to action and are ready to respond as to end the epidemic of NTDs by 2030. Thank you. Now for the annual report on the NNN growth and achievement during the 2019 to 2020. So despite the unprecedented challenges under the COVID-19 pandemic, I really commend the cross-cutting, disease-specific and other ad hoc groups on their continued momentum this past year. Thank you all. I would like to start with changes to the NNN membership and the groups. The NNN continues to grow through the membership of 4 new members: the Global Partnership for Zero Leprosy, the International Alliance for Global Health Dermatology, Parasitology and Public Health Society of Nigeria, and the Swiss Alliance Against NTDs. So now we have a total of 85 NGO members and 3 observers. In 2020, next, the External Representation Committee was reorganized to form the 2020 Influencing Priority Task Team. The team has strategically focused its work on targeting engagement with the new NTD roadmap, the Uniting to Combat NTD Partnership Strategic Review, and establishing NNN positions in response to global events affecting the NTD communities. Thanks to the newly formed 2020 Communications Task Team, next, we have streamlined our strategic communications to members, observers, and external audience through the website, social media channels, and email missives. I want to particularly thank Will Austin for his voluntary support and instant responses on maintaining our website and tweets. In light of the growth and change of the NNN, next, the Executive Committee has reviewed and updated the NNN framework for engagement. So this resource provides transparency and accountability of the function and the governance structure of the NNN. I really encourage you to read this too on the NNN website. As a reminder, the Executive Committee is composed of the chair, vice chair, immediate past chair, and representative from each of the 11 cross-cutting and disease-specific groups. Please visit the NNN website for contact details of any of these members. Next, reflecting the need, we created 3 new ad hoc task groups. The Safety in NTD task group was formed to develop tools and resources to support safety planning and messaging. The NNN is a community of practice striving to improve our ways of working by sharing learnings and fostering knowledge exchange. The knowledge management task group was formed to explore and define an NNN approach to knowledge management. In response to the challenge under the COVID-19 pandemic, a COVID-19 task group was formed to coordinate among partners and develop approaches in risk assessment along with mitigation tools and strategies. The annual NNN conference is just a small piece of our work as a forum. The NNN carries out the bulk of its work through member-driven work streams like via the cross-cutting, disease-specific, and other ad hoc groups. And now for some highlight of the key achievement. Next. The NNN started the year by celebrating the first ever World NTD Day on January 30th. Through social media, blogs, and the interview, we joined more than 350 other organizations to raise awareness on NTDs and to reinforce our commitment to beat NTDs for good and for all. World NTD Days also marked the 1-year anniversary of the WHO NNN WASH NTD Toolkits. Next, in the context of COVID-19 pandemic, the NNN issued a solidarity statement in support of the WHO. Since June, the influencing and communication task team and the NNN members have actively contributed to supporting the WHO NNN webinar series. We thank the WHO NTD department for opening paths of collaboration on strategic communications issues across COVID-19, MDS safety, sustainability, use, and WASH, to name a few. Next slide. The WASH group worked hand in hand with WHO to update this global strategy on WASH and NTDs and to promote and use WASH and NTD toolkits, including preparation for the regional workshops in the Pahol region and East Africa. Next slide. The Disease Management, Disability and Inclusion DMDI group launched the iLab NNN guides on stigma and mental well-being. The new guides were rewritten to incorporate improved insights, align with current evidence, and make mental well-being an integral component. You can access this site on the Info NTD website. Next slide. The group also finalized the Journey Through Care conceptual framework detailing desired health, social, and emotional outcomes of persons affected by NTD and their family members. NNN values the contribution from persons affected by NTDs and advocates for their inclusion in advocacy, policy, and programming. NNN's statement of commitment to the participation of persons affected by NTDs proposed by the DMDI group truly reflects this. This new statement will be adopted at the closing plenary. Next slide. The Conflict and Humanitarian Emergency Group, working with Monterey, developed an NNN resource guide for the conflict and humanitarian emergencies. This is live on the NNN website, and more details will be given during their rapid fire sessions. Thanks to the Carter Center for sponsoring this project. NNN next slide, provide a strong support to the Uniting to Combat NTD partnership throughout its transformational process. NNN and the member NGOs worked closely with other stakeholders to support the establishment of the new governance structure of the partnership. NNN contributed to the preparation for the joint malaria NTD Kigali summit, now postponed to 2021. So we were delighted to contribute to the UTC's powered partnership under the Neglect virtual event, which took place on the 25th of June to support momentum on global attention to NTDs. Via the UTC's consultative forum, NNN supported UTC's strategic development through discussion, consultation among NNN members. With the new NTD roadmap, a strong partnership engaging all stakeholders is the only way to help build resilient health systems that can weather public health emergency and deliver the 2030 NTD goals. Next slide. The NNN annual conference rely on our generous support sponsors. So the COVID-19 has put huge financial pressure and changed the mood of working for every organization. But regardless of this challenge, organizations have generously come forward to support this year's conference. Our platinum sponsors are the American Leprosy Missions and the Bill and Melinda Gates Foundation. Our gold sponsors are the Carter Center, CBM, ACI Foundation, and NLR International. Our silver sponsors are Uniting to Combat NTDs, WaterAid, Helen Keller International, Footwork, the International Podoconiosis Initiative, International Foundation for Dermatology, MitoSARS, and Site Savers. Our sponsor, bronze sponsor is FHI 360. Their profiles are shown on the sponsors web page of this site. So thank you all for your support. Next slide. After the successful collaboration with the American Leprosy Mission on the first ever NTD Innovation Prize last year, so we are excited to continue this collaboration this year with a version 2. So innovation is always essential in addressing critical challenges to achieve universal health coverage in a changing world. And this is particularly true in NTD programming. So we will hear more in the next session introducing the Innovation Prize and the innovative ideas. Next slide. So this brings me to another innovation-oriented related collaborations. So this year, the NNN is collaborating with the Bill and Melinda Gates Foundation to facilitate the engagement of NGOs on discussing the challenges and innovative approaches in the planning and implementation of NTD interventions in the context of COVID-19. And you will hear more on this later and throughout the 3 days. So these 3 days will bring to you 18 workshops and 2 rapid fire sessions. Next slide. This year we received a total of 48 quality workshop proposals, and each proposal went through a rigorous review and appraisal process by independent reviewers from within the NNN membership. I would like to thank those of you who contributed to this process. The rich selection covers cross-cutting areas across the 4 pillars of the NNN, the best framework. Centered on this year's conference theme of resilience and sustainability, these sessions will stimulate further discussions and innovative thinking based on the shared experience, learning, and best practice. Each session invites engagement from NGOs, national programs, donor agencies, private and corporate foundations, and in particular, persons affected by NTDs into the conversation. So these diverse stakeholders from within the health sector and beyond all have a role to play this coming decade in ending NTD once and for all. I would like to end this report by wishing you all exciting 3 days ahead of us. Share, learn, and engage. Thank you. And now let's enjoy the presentation on this year's NTD Innovation Prize by the American Leprosy Mission for the next session. Thank you.
Innovation is an incremental, novel adaptation of an existing idea or a disruptive new solution.
Innovators use ingenuity and work together to develop new solutions.
Innovation is focused on getting sustainable solutions to the people affected.
Innovators think big.
Innovation accelerates progress and breaks barriers to health access.
Innovators are relentless.
Innovation has sustainable, positive impact.
Innovators have an unshakable belief in what is possible.
Innovation needs partnership and collaboration.
Innovators can come from anywhere.
Innovation propels us forward.
Innovators have an inspiring spark of creativity and hope.
Innovation is the exploration and application of new or improved solutions to stop disease and improve well-being for people affected by NTDs. My name is Bill Simmons, the President and CEO of American Leprosy Missions, and I join with others in welcoming you to the 2020 NNN Conference. In cooperation with the NNN, it is our pleasure to announce the finalists for the second NTD Innovation Prize. It's a privilege to be among so many great organizations and people who care about making the world and people's lives better by solving the complex issues around NTDs. Now, working in NTDs is fraught with obstacles, and sometimes we and our partners feel stuck. A lot like one of our teams found themselves in the Democratic Republic of the Congo. They were stuck, and willpower wasn't going to get them out of this mud and muck. Well, that's when innovation and ingenuity came to the rescue. These local guys, they came to the rescue with their tools, but these were just everyday items. And so they worked together to use these items in ingenious and novel ways. And that is precisely what getting unstuck in NTDs will require. Many of you watching this are actively engaged in developing new solutions and methods to break the stagnation. And so what new technology can be brought to bear on NTDs? What current tool could be adapted for a new use or purpose? And why do barriers to inclusion still persist? And what innovation can disrupt those perceptions? Well, these are questions I am convinced can be answered by those of you watching this around the world. Since American Leprosy Mission's founding in 1906, we too have been at the forefront of applying innovative solutions that create sustainable, positive impact for people. Breaking from norms and driving innovation, that has compelled and propelled us to action in all sorts of ways for decades. In the 1930s, we began partnering directly with ministries of health in countries like Nigeria. In the 1940s, we helped pioneer the novel leprosy drug treatment, Diazone. In the 1970s, we developed special farm tools and equipment for anesthetic hands. Then in the 1980s, we worked with the Philippines Department of Health to pilot multi-drug therapy for leprosy. More recently, in 2018, the studies that we financed led to the introduction of a new oral drug regimen for Buruli ulcer. And just last year, our project to develop the world's first leprosy-specific vaccine completed phase 1 clinical trials. American Leprosy Missions has continually sought new and innovative ways to cure, care, and end leprosy and other high morbidity NTDs. As a faith-based organization, we feel that our Creator, God, has imbued all people with dignity. And that belief has driven our work around the world since our beginning in 1906. The suffering caused by NTDs can shatter people's dignity. Preventing that shattering is what drives us as an organization to rid the world of high morbidity NTDs. So more than 2 years ago, our Vice President of Innovation, Darren Shaw, instigated our launch of the prize to encourage innovation in NTDs. The response we have seen after just 2 years has been overwhelming, and it gives us hope. So we launched the first $25,000 NTD Innovation Prize in 2019 to identify and support innovators with creative ideas to solve some of the most challenging issues posed by NTDs across the globe. Last year's prize was awarded to Dr. Tito Tresor Malacchio, a medical entomologist based at the Center for Research in Infectious Diseases in Cameroon, and his partner, Mr. Joseph Price, from the Liverpool School of Tropical Medicine. Their project? Exploring the viability of excreta sampling for monitoring human African trypanosomiasis. Now, this project is developing new tools for tracking the spread of sleeping sickness. This year, we're partnering with Novartis, equally committed to innovation. And we're offering two prizes, a $15,000 second prize and a $20,000 first prize. American Leprosy Missions and Novartis, we feel it is critical to encourage and support creativity and ingenuity within the NTD space and to fund new ideas that could result in cost-effective, scalable, and transformative positive impact. Now, there are hundreds of people who are using their talent, skills, and ingenuity to innovate around solving the intractable problems facing us in many NTDs. So building on the success of last year's prize, we received more than 50 submissions this year from 19 countries addressing 10 different NTDs. And our evaluators and judges, they've had to narrow the field down to the 5 finalists that you will meet today. American Leprosy Missions and Novartis are committed to helping to support the innovations that are needed to move us toward the finish line as we walk the last mile. As all of you know, the work in diseases gets more difficult, not easier, the closer we get to seeing an end. And that's why innovation is so critical to bring to the fore. It is my pleasure to invite Novartis to share their thoughts on this year's prize and their commitment to driving innovation.
Hi, so this is Patrice Machaba. I'm the Group Head of Global Health and Corporate Responsibility. So first of all, congratulations to the 5 finalists trying to find solutions to eliminate leprosy and neglected tropical diseases. Neglected tropical diseases, we know, still impact over 1 billion people in the world, and mostly in sub-Saharan Africa, South America, and Asia. And for malaria, for example, we know that malaria targets children under 5. Hundreds of thousands of them die every year from malaria, and also pregnant mothers are impacted. And in sub-Saharan Africa in particular, where there is malaria, invariably we find sickle cell disease, and children who have sickle cell disease, they have a higher death rate again from malaria and bacterial infections, and only about 20% of them live beyond 5 years. So we should eliminate neglected tropical diseases. From Novartis, you have our commitment from our Novartis Institute of Tropical Diseases. We will continue to research, develop, and find new medicines, not only for malaria, but also for Chagas disease and for leishmaniasis and dengue. This is very important. And we as Novartis will also create partnerships with NGOs, with you yourself, with patient organizations and the government. So we create ecosystems and use technology to eliminate neglected tropical diseases. Now, one thing I have learned, and I guess everybody has learned from the COVID-19 pandemic, that an infection that starts in one country, and it may be a poor country for that matter, quickly spreads around the world. And what we have realized is that the only real wealth in the world is good health. And that good health for human beings is also tied to the health of the environment. So what you do is important, and let's work together to eliminate neglected tropical diseases once and for all. Please enjoy the conference, and good luck to the winner.
Hi, Mark Rogers. I'm a Global Program Head here at Novartis, in charge of neglected tropical disease. It's a great pleasure to be here today to announce the results of this innovation competition, aiming at fostering new innovative idea in the field of neglected tropical disease. It's a real pleasure, first of all, to have had the opportunity to collaborate with the wide array of stakeholders, including obviously our key partner in crime for this innovation prize, the American Leprosy Mission, because at Novartis we really believe that the fight against NTD can only be successful if a very diverse set of stakeholders across the board gets together and puts their head in the same direction. Second, I'm extremely impressed by the level of the proposal that we've received. Of course, we had to select a few as winners and finalists, but a lot of what we've seen has the potential to change what we do to fight neglected tropical disease. And I think that only through innovation we'll be able to really move the needle in this area. Finally, I'm extremely happy to be able to help take the two best proposals forward and to try to scale them and advance their implementation, because at the end of the day, it's what we do on the ground that matters. So thanks for everyone who has participated to this edition. It's been a real pleasure, and we're looking forward to see the impact on the ground.
Innovation needs partnership and collaboration in order to succeed. We are thrilled to join with Novartis in supporting innovators like this year's finalists. In a world beset by COVID-19, millions of people still daily face the challenges and effects of NTDs. My own organization has had to persevere through every major global pandemic, economic crisis, and war since 1906. And we will persevere through this one too, but not alone. It's working with people like you. We will accelerate toward our shared goal of seeing lives changed and dignity restored. American Leprosy Mission's Executive Vice President of Programs, Stephanie Weiland, will now introduce you to this year's 5 finalists. Stephanie has a passion for the people who face the challenges of NTDs firsthand and those innovators with the drive and compassion to transform lives.
We are here to celebrate innovators. An innovator can come from anywhere, but not everyone can be an innovator. And this has been true throughout history. Let me tell you about one fascinating innovator from the early 20th century. These were turbulent times. Socially, politically, and scientifically. Imagine it. World War I and the Spanish flu are destroying a generation of Europeans and Americans. Women around the world are on the move to claim rights as equal citizens. Marie and Pierre Curie are pushing the edges of knowledge in chemistry and physics at the cusp of the extraordinary discovery of radioactivity. Enter Alice Ball, a young black chemist in Hawaii, which is still a territory of the U.S. at this time, not yet a state. She is fascinated with the properties of the kava plant, and her work progresses. Alice Ball becomes the first woman and African American to receive a master's degree from the University of Hawaii, and the first female and African American chemistry professor there. Dr. Harry Holman, a leprosy doctor, invites her to work with him to improve leprosy treatment. At this time, people affected by leprosy in the United States live in exile on a remote island with almost no chance of recovery. For many years, people had used a promising oil derived from the kava plant for therapeutic purposes, but it's not effective until Alice Ball develops a new technique. With a spark of creativity and the hope that the kava plant's oil can really do something, she isolates the oil's ester compounds and then modifies them so the oil can be injected and absorbed by the body. The new treatment is effective and shows great results not seen before with Dr. Holman's patients and others. The technique Alice Ball develops remains the preferred treatment for leprosy around the world until the 1940s, when antibacterial drugs are developed. Despite having a major impact on countless people affected by leprosy for so long, no one even knew about her until decades after her death. That's because the dean of her university published the findings under his own name and named the technique after himself. It was finally renamed the Ball technique recently when researchers found her papers in the University of Hawaii's archives. Alice Ball's contribution to science and global health was finally honored last year when her name was added to the frieze at the London School of Hygiene and Tropical Medicine, along with Florence Nightingale and Marie Curie. What kind of person does it take to leap over discrimination and challenge to the point of groundbreaking creativity and innovation? I see three common qualities in innovators. First, an innovator thinks big. Their goals are big, beyond the everyday task of delivering short-term results. This quality makes innovators step out to experiment and take risks for a big payoff. Alice Ball charged ahead to do something new that would make it possible for people affected by leprosy to have effective treatment and benefit from the possibilities of chalmugra oil. Secondly, an innovator is relentless. They exert enormous determination, often through multiple failed experiments, and they do not give up until they find a solution. Dr. Holman wrote that after a great amount of experimental work, Miss Ball solved the problem for me. And thirdly, an innovator believes in what is possible. The drive that keeps them going day after day is the unshakable belief in what is possible. What else can explain this spark of creativity in Alice Ball to overcome every system and prejudice against her and make a remarkable advancement for people affected by leprosy? Now for the exciting part, the prize finalists and their innovations. I'm pleased to introduce you to 5 innovators who are our 2020 NTD Innovation Prize finalists. In no particular order, they are Dr. Arie de Kruijf, Dr. Suash Baral, and Dr. Deanna Hagee from the Leprosy Mission, and Professor Yanis Spigoulis from the University of Latvia, Institute of Atomic Physics and Spectroscopy. The title of their innovation is Applying Spectral Imaging to Leprosy Diagnosis.
Despite the free and effective treatment being available, the prevalence of leprosy is still static in many endemic countries. One of the main causes of this is the delay and difficulty in diagnosis, which depends mainly on clinical evaluation and testing. Laboratory tests are invasive and only available in bigger centers. Earlier diagnosis of leprosy reduces the risks of complications of leprosy and leads to a reduction in the transmission, leading to a reduction in prevalence in the long run. Many leprosy endemic populations are in poor resource settings where field workers have to assess cases by viewing and counting skin lesions. Many cases are missed or misdiagnosed, and sending people for confirmation would bottleneck treatment. A diagnostic tool for this context that could be non-invasive and cost-effective would go a long way in helping people affected by leprosy have the correct diagnosis. We hope that this project would increase exponentially the access of people affected by leprosy to a timely and good diagnosis, to reduce the risk of complications and reduce the transmission of leprosy. But we also dream that maybe this concept can be applied to many other skin diseases, creating more assessment options to peripheral healthcare workers where leprosy and many other neglected tropical diseases are more prevalent.
Our team plans to explore the use of spectral imaging as a way to collect optical skin biopsies, a tool that could potentially enable the spectral modified smartphone to diagnose leprosy or other skin NTDs in minutes.
Laura Braun and Kai Reimer from Imperial College London in the United Kingdom. The title of their innovation is CAPTA, an automated diagnostic tool for detecting parasitic worms.
Parasitic worms, including schistosomiasis and hookworm, affect 1.7 billion people worldwide, primarily living in the most marginalized communities. They lead to anemia, diarrhea, stunted development, and eventually death. Significant health damage can be prevented with early diagnosis, but the problem is that diagnostic tools are labor-intensive, lack quality control, or require expensive equipment that is often unavailable in low-resource settings. Parasitic worms are most commonly diagnosed by examining a sample of urine or stool under the microscope. Trained staff identify and manually count the different worm eggs. But this diagnosis depends on qualified lab technicians, and quality control is difficult because eggs can easily be missed or miscounted. CAPTA is solving these problems by developing a low-cost, accurate diagnostic tool. It consists of a handheld microscope that connects to any smart device. By placing the microscope on a slide, samples are automatically analyzed for a number of eggs and species using machine learning. This significantly reduces the time of diagnosis, eliminates human error, and thereby makes diagnosis both cheaper and more accurate. CAPTA could therefore both enable a test and treat approach and more targeted drug distribution.
Monica Stanek from the Liverpool School of Tropical Medicine in the United Kingdom. The title of her innovation is Tracking a Sandfly, evaluating lightweight molecular tagging, smart water, as a novel insect marking technique.
Leishmaniasis is the world's most important global neglected tropical disease, with approximately 70,000 deaths reported annually. Leishmania, the parasite which causes leishmaniasis, is transmitted by female sandflies. Therefore, insect control measures, which consist of insecticide spraying, is an essential component of disease control. Although insecticide spraying has reduced leishmaniasis cases in some countries, such as India and Bangladesh, in Brazil there has in fact been a recent increase in leishmaniasis burden. One of the main reasons for this increase is the ineffectiveness of current insect control methods due to the development of insecticide and behavioural resistance, which has resulted in sandflies dispersing to untreated areas. Therefore, in order to develop new, targeted sandfly control interventions, we need to further understand sandfly dispersal and flight behaviour in endemic areas.
Our collaborators at the National Institute of Health in the US have recently developed a novel molecular marking technique. This technique repurposes forensic marking materials which have been provided by the Smart Water Foundation and combine this with a DNA molecular tag. This means we can not only fluorescently mark insects, but we can also date mark them upon release. That means that we can know exactly where and when these insects were marked.
Arnaud Efon Ekongwo and Dr. Hugh Nana Junga from the Center for Research on Filariasis and Other Tropical Diseases in Cameroon. The title of their innovation is Cell-Free DNA, a promising biomarker for onchocerciasis elimination mapping.
River blindness is a debilitating vector-borne parasitic disease responsible of skin disease and visual impairment that can subsequently lead to blindness. About 20 million people are currently infected, 99% of them living in Africa. The control of river blindness relies on yearly ivermectin-based preventive chemotherapies. However, the monitoring of the performance of control programs is challenging because existing diagnostic tools are not reliable.
The current diagnostic tools, relying either on immunological basis or microscopy of skin specimens, have intrinsic drawbacks related both on lack of sensitivity, diagnostic failures, and community refractoriness to skin biopsies. This situation is a major obstacle to the collection of accurate and representative data required for an optimal implementation of control strategies. Therefore, innovation is needed for the development of a new diagnostic approach that will allow the detection of a suitable biomarker with property robust enough to overcome the limitations associated with current diagnostic tools.
Marcelo Tavora Mira from the Pontifical Catholic University of Paraná in Brazil. The title of his innovation is Prediction of the Occurrence of Leprosy Reactions Based on Bayesian Networks.
A lot of very bright scientists from all different fields have been studying leprosy reactions for many years and have been producing this very exciting data that helps us to understand why these episodes happen and how. The problem is that this information is very compartmentalized. And then it's very difficult for the professional at the primary healthcare center, like a doctor or a nurse, to use this information and translate it into something that is useful to their patients. So we decided to apply artificial intelligence to create a system that can use clinical, socio-economical, environmental, and host genetic and non-genetic data to calculate the risk of an individual to suffer leprosy reactions. We did that by studying 1,450 patients enrolled in different leprosy references centers all across the country. For all of the patients, we have extensive clinical and laboratory data, and for some of the patients, we've even had molecular data from some specific genes associated with the occurrence of leprosy reactions.
These are some amazing individuals pushing the boundaries to create solutions for stubborn problems in NTDs. If realized, these 5 solutions could achieve momentous results. Imagine it: drastically cutting costs and time to diagnosis, earlier treatment and prevention of disability and suffering, and tracking down and eliminating vectors and transmission of disease. All of these innovations have the potential to significantly improve the lives of people suffering from NTDs. And these innovators have that inspiring spark of creativity and hope. Don't miss out. Join us for the closing session of the NNN conference to find out which of them will be our 2020 Innovation Prize winners. We believe that collaboration is a key ingredient to success in beating NTDs. As Bill mentioned, American Leprosy Missions launched the Innovation Prize in collaboration with the NNN. And this year, Novartis joined to help accelerate the effort. Alice Ball's brilliant innovation grew out of her collaboration with a leprosy doctor. And notice how most of our entries in the Innovation Prize contest are also the result of collaborative effort. When we put our minds and capabilities together, we can spark the creativity and hope we need to explore and apply innovative solutions to stop disease and change the world for people affected by NTDs. Let's think big, pursue solutions relentlessly, and share our belief in what is possible. Our movement is gaining traction. Won't you join us?
Thank you, LM. Congratulations to the 5 finalists, and we look forward to the announcement of winners on Thursday closing plenary. So now I would like to invite Simon Brooker, the Deputy Director, Neglected Tropical Diseases at the Bill and Melinda Gates Foundation, to introduce the collaboration.
Good morning, everyone. I'm Simon Brooker from the Bill and Melinda Gates Foundation in Seattle, and I'm delighted to tell you today about the NTD Idea Forum, a series of virtual meetings hosted by the Bill and Melinda Gates Foundation, the Children's Investment Fund Foundation, ELMA, ESPN, and the UK's Foreign, Commonwealth and Development Office. The meetings seek to present and discuss innovative ideas which can advance NTD programs in the context of COVID-19. We all know that this pandemic has severely disrupted societies and resulted in many health services and programs being suspended, including those for NTDs. Under recent WHO guidelines, programs are now looking to restart activities. As they do, the public health landscape will be very different and programs cannot resume business as usual. There will be a need to identify innovative solutions in how interventions are planned and delivered to achieve large-scale health impact and to build stronger, more efficient programs. We suggest there are at least 4 ways that NTD programs may need to evolve in a world with COVID-19. First and foremost, programs will need to adapt delivery of interventions to communities in order to minimize the risk of coronavirus transmission. Second, there may be opportunities to integrate across NTD programs and with other health campaigns. Third, programs can improve and optimize the way they plan and deliver interventions. Lastly, there are opportunities to accelerate progress towards the 2030 roadmap goals by intensifying the frequency or scale of recommended strategies. The NTD Idea Forum will bring the community together to explore current challenges, hear about lessons learned from places where innovation has already taken root, and discuss new approaches. Funding will be available for the best ideas. There will be free funding forums covering the 4 themes: Adapt and Integrate on October the 1st, Optimize on October the 8th, and Accelerate on October the 14th. To inform the forum, we partnered with ESPN to conduct a series of workshops and an online survey where we heard input from 36 program managers across Africa on the challenges for resuming interventions, as well as opportunities to deliver more effective programs. We would also like to hear your experiences and suggestions, and there is an online survey for NGOs to complete at this link. The free forum meetings are open to everyone to attend, and any individual and/or team for national programs or not-for-profit or commercial organizations can propose an idea. We strongly encourage submissions from endemic countries and are looking for solutions that represent the diversity of our global health community. We ask you to submit a 1-2 page concept note outlining your idea and the challenge it seeks to overcome. The most promising concept notes will be invited to pitch their idea at one of the free forums, and funders selecting the best ideas for funding. The amount available for each proposed idea will be approximately $200,000, and of course you can request a smaller amount. Larger funding will be available for exceptional and truly impactful ideas. The idea that you pose must provide a solution to the challenges faced by NTD programs in a context of COVID-19 and propose a solution that introduces innovation and new approaches. Unfortunately, we cannot consider requests for routine delivery costs or increased supply or staff requirements. The NNN has already embraced innovation through its collaboration on the Innovation Prize, and we look forward to your input and participation into the current forum. There is a conference chat channel where you can initiate discussion around different themes and to send us questions about the forum itself. Full details are available on the forum's website indicated here. I wish you a successful conference, and on behalf of all of the forum hosts, look forward to welcoming you to the discussions. Thank you.
Thank you very much, Simon, for the introduction. Please also note at the Pathable event site, under the discussion, there is a specific chat channel that will be available throughout 3 days. So please do go there to have a chat. So at every year annual conference, we have a session which is very important, and that is the selection of our next vice chair. So I'm handing over to Kizito to have the introduction. Kizito.
Yes, Yalvi, thank you very much. Good morning, good afternoon, and I say late evening for people in Australia. So I want to introduce again to you the vice chair roles and responsibilities. Of course, the candidates should have a mix of complementary skills, programmatic expertise, and experience, be in a position to dedicate sufficient time to the diverse and dynamic needs of a growing and ambitious network, and be from an NNN member organization. The person should provide support and advice to the chair in decision making, act for the chair when the chair is not available, and undertakes assignments as at the request of the chair. Should be, will be a member of the executive committee and the steering committee, and of course will be the chair to the conference committee. It will represent NNN as needed in external meeting as required by the chair or the steering committee. This year, I'm happy to say that, I don't know, Yaobi, should I be happy with that? But we have a sole nomination, one person, And therefore, I think, Yaobi, I should advise that there won't be any NNN member voting to be undertaken. So we will go without voting this time. Is that okay with you, Yaobi, I suppose?
And I think it's to the participant, to the members. I think although there's no voting needed, but we do need endorsement from the members to formally confirm at the closing. So she will be. Do you want to introduce her?
So yes, we will do. So she's been nominated by Stefan Amonide. He's from World Vision, and her name is Ariel Dolegi, and she's a global health practitioner with over 13 years of experience managing complex health system, strengthening program, and implementing strategic approaches with result-oriented program design. She's been working with supporting neglected tropical diseases, community health, and livelihoods, HIV, and sexual reproductive health programs. Currently, she's working as the technical advisor for cross-cutting coordination under USAID Act to End NTD West program, where she leverages the organization's vast network and existing community infrastructure and private resources to support the fight against NTDs. She will talk, she will present herself, I suppose, when the NNN member endorses her at the closing plenary. And Yaobi, I need just to reiterate, remind you that remind everyone, as Father Matter, the formal transition of the NNN steering committee will take place on Thursday at the closing plenary, where Ariel will introduce herself further. So on that note.
Okay. Thank you very much, Kisito. So Ariel will not be appearing. Do you want to switch on your video so people can see you? Ariel?
Ariel? I see your name on the participant list, so.
I'm here. I'm waiting for I don't know if I'm unmuted yet by the.
No, we can hear you now.
Yeah, but I need, so my video is on, but I'm waiting for the conference organizers to turn it on. But just so I can show my face. But so thank you, Kizito, and thank you, Yaobi, for the nomination. And I look forward to formally introducing myself once I receive the endorsement from the membership on Thursday. Thank you.
Thank you very much, Ariel. If you would like to just try turning on your video just for a brief second, and we'll be able to see you. There we go. Lovely. Thank you.
Hi, everyone.
Thank you.
Great.
Okay, over to you, Yaobi. Thank you very much.
Welcome. Thank you very much for your commitment to become the incoming new vice chair. And thank you very much to World Vision as well for the organizational support and the commitment. It's great to have you. And so we will hear more from you at the closing and officially. And people now see you, know who you are. So hope everybody will be happy to have you as the new vice chair. So as timing is just 2 minutes past the end of this session, it's not too bad. We're keeping the time very well. Thank you very much. Now it's end of our opening, and let's have a good rest and see you again in different workshops at 1 p.m. British time here. Thank you.